Hepatitis is inflammation of the liver. But inflammation is only the beginning of a much deeper problem. The liver is not just another organ in the body. It functions as the body's metabolic command center. It detoxifies harmful chemicals every single day. It metabolizes medications that you take regularly. It processes nutrients from the food you eat. It produces essential proteins required for survival. When the liver begins to deteriorate, the entire body becomes vulnerable. Every system depends on a healthy liver. In the United States, the most common viral forms are hepatitis B and hepatitis C. Hepatitis A can still cause outbreaks in certain communities. Hepatitis B spreads through blood and bodily fluids. It can spread through unprotected sexual contact. It can spread through shared needles. It can even be transmitted in healthcare settings. This happens if proper sterilization is not followed. Hepatitis C spreads primarily through blood-to-blood contact. Its transmission increased significantly during the opioid crisis. Shared injection equipment played a major role in that increase. Even microscopic traces of infected blood can carry the virus. Once the virus enters the bloodstream, it targets the liver. It begins replicating silently. There may be no more immediate pain. There may be no more dramatic symptoms. Everything can feel completely normal. Over time, scar tissue begins to form. This process is known as fibrosis. Fibrosis slowly replaces healthy liver tissue. If fibrosis advances, it becomes cirrhosis. Cirrhosis is irreversible. Cirrhosis can ultimately lead to liver cancer. Liver cancer is associated with high mortality rates. Alcohol consumption accelerates liver damage. Alcohol inflames liver tissue. When combined with viral infection, destruction intensifies rapidly. Misuse of certain medications can also harm the liver. Excessive acetaminophen is a common cause of medication-related liver injury. Many people underestimate the risk of over-the-counter drugs. Obesity adds another serious layer of risk. Fat accumulation in the liver causes inflammation. This condition is often called fatty liver disease. Fatty liver disease can coexist with viral hepatitis. When conditions combine, outcomes become worse. It is often a late signal. Prevention and the early intervention are entirely possible. Vaccines are available in the United States for hepatitis A. Vaccines are also available for hepatitis B. These vaccines provide strong protection. Unfortunately, there is no more vaccine for hepatitis C. Screening becomes extremely important. Every adult should consider being tested at least once. Certain age groups carry higher risk. Those born between 1945 and 1965 have higher prevalence of hepatitis C. Testing is simple. Testing can save lives. Modern antiviral treatments have transformed outcomes. Most cases of hepatitis C can now be cured. Hepatitis B can be effectively suppressed with proper management. Early diagnosis improves survival rates dramatically. Avoiding shared needles is critical. Practicing protected intimacy reduces transmission risk. Limiting alcohol consumption protects liver tissue. Reading medication labels carefully prevents accidental overdose. Maintaining a healthy weight reduces fatty liver risk. Staying physically active supports metabolic health. Requesting routine liver function tests during annual checkups is wise. Small decisions create powerful protection. The liver has a remarkable ability to regenerate. It can repair itself after injury. But this capacity is not limitless. Once cirrhosis develops, reversal becomes extremely difficult. In severe cases, liver transplantation may be the only option. Donor organs remain limited. Not everyone receives a transplant in time. America has extraordinary medical capabilities, yet technology alone cannot compensate for lack of awareness. Awareness leads to prevention. Prevention leads to survival. The most dangerous epidemics are often the quietest ones. Viral hepatitis remains one of them. Protecting your liver requires conscious decisions. It requires informed action. It requires timely testing. Act before irreversible damage occurs. Like this video to help spread awareness. Share it with someone who believes they are completely healthy. Follow for more medically accurate, evidence-based health content. Your liver works silently every day for you. Make sure you do not ignore it.